ma'am. So now we're going to be inspecting your lungs and your heart. Okay? So patient's respiration, rhythm, and lung expansion seems normal. She's not using any of her accessory muscles, and her chest wall seems symmetrical. There are no abnormalities, no protrusions of any kind. Okay, so I'm going to be palpating you. Okay? Able to palpate the clavicles bilaterally, able to palpate the jugular notch, able to palpate the sternal angle, able to palpate the sternum, able to palpate the xiphoid process, able to palpate the vertebral prominence, able to palpate the lower border of the scapula on the left and on the right, able to palpate T12 and also rib 12. Okay, so ma'am, could you go ahead and take a really deep breath for me, please? Okay, go ahead and breathe out. Lung expansion is normal posteriorly. I'm going to be doing the same thing, but anteriorly, okay? So go ahead and take a deep breath. Breathe out. Lung expansion is normal anteriorly. So while we're here, go ahead and say 99 for me.
99.
Again?
99.
One more time.
99.
Okay. We're going to do the same thing on the back. Go ahead and say 99.
99.
One more time.
99.
One more time.
99.
Okay, so tactile firmness is normal. There is no abnormalities there. Great. So now I'm going to be percussing. Okay, so let's start with the front. I'm going to be doing the same thing on your back. Okay, great. So now I'm gonna be auscultating. Okay, just go ahead and breathe normally. Okay. Okay, great. Okay, so this next part is the heart part. So go ahead and lay back for me, please. Okay, go ahead and lay a little more back. Thank you. 30 degrees. Okay, so patient's neck seems normal. There are no abrasions. There are no abnormalities, no lesions. I'm just going to be making her a little more comfortable. Okay, so she's at 30 degrees. All right, so I'm going to be palpating your carotids. Okay. Okay, so there's a brisk upstroke on the left carotid. Brisk upstroke on the right carotid as well, so they're normal. Now we're going to be checking your JVP, and what I'm going to be doing is we're going to be putting my ruler right over the sternal angle of the patient, and I'm going to be checking for the jugular vein. So go ahead and turn to the left, please. Great, so I see it right here. I place it right there, And it is about 3 centimeters, which is normal. So normal JVP for the patient. Okay, so now I'm going to be palpating again. Okay? Okay, so there are no heaves. And there are no thrills. The precordium is normal, and I'm going to be auscultating. Okay. So that appears normal. The PMI appears normal as well. Go ahead and turn onto your left lateral side now. So what I'm going to be doing now is I'm going to be auscultating for your point of maximal impulse to see if it's changed at all. So the PMI has remained the same. PMI and radial pulse are, they correlate. They correlate normally. Okay, go ahead and sit up and lean forward for me, please. Okay, PMI is still normal. Okay, thank you so much.
Thank you.